So one thing you may notice here, this is just our regular veterinary bucket, and we have it in a, we thawed it some in the sink at the clinic, and then we always just grab a bucket, put a garbage bag in it, fill it up with hot water, put it in there, tie it up. By the time we get here, it's ready to go. But we're only like 1.5 miles, 2 miles away, so it may not be quite ready. We'll see. So on the Poitous, it's definitely easier to clip the hair because of their hair coat. So we'll always clip the hair, and then we'll do a quick scrub of the injection site where we're going to place a catheter. I use a 16 gauge by 2 inch catheter that's not sutured in. We just hold it in place for a few minutes. Thank God, dealing with Poitous, you can hold them after a few minutes. They normally will just kind of melt into you and stand there. If there were other breeds, it's not quite as simple. But anyway, we use a 16 gauge catheter, primary blood set with a 200 micron filter, and then gloves, sterile or non-sterile, depending on your ability to do this. And then a purple top tube to pull the IgG. You want to make sure you pull the IgG prior to administering the plasma. And then we have a plasma down here. It's all good and ready. We'll leave it sitting there until we start administering it. This is Rhodococcus equi antibody. I'm trying to, Lake Immunogenics, Ontario, New York is where this one comes from. There's a few other ones out there. I can't say that one's any better than the other. I just said I had really good luck with this one, and so that's one I use. And it's, our vendor carries it readily, so that allows me not to have to stock it. And so I can call and get same day delivery on it every day. I mean, if I order before 11, I get it that afternoon, normally by 2 o'clock. And so I generally only keep one on hand because I can get it so readily.
Is it freezer stable?
It is frozen when you get it, and it remains frozen until you thaw it. Once you thaw it, you have to use it. Do not thaw it in a microwave. Do not thaw it on the dash of your truck because of the sunlight. But there's, I think that's the one that has the label in it that says do not use it in a microwave, and surprisingly, I'm sure somebody's tried it. I do use lube whenever I rectal the baby. If you want to, will that Jeannie let you catch her? Okay. So what you think is going on in some of the cases is that there is inadequate colostrum or inadequate colostrum, inadequate colostrum or inadequate ability to get the colostrum that the Jenny has, because they're not the best mothers. Chris and Patrick have told me that since day one, and over the past 10 years, that's what I've come to realize. They're not very good mothers. You have some that are amazingly good mothers. She can come closer too, Chris. And you have some that are just not very good mothers at all. So there's a hole. If it's there available, then you also got to get it in them. And so one way to make sure that they get it in them is to do what we're doing. So you see how she's holding this baby? You try to get the tail, don't grab under the barrel of the abdomen. And see, there's meconium going right there. These things are not like poking a needle in a fold. Their skin is much thicker, much tougher, and their vessels tend to move quite a bit more. So it does become a challenge sometimes getting these in, especially if they're dehydrated.
Understatement.
Yeah, that's an understatement.
So the area you shaved exposes the jugular?
Yeah, so that's shaved over the jugular groove, which exposes the jugular vein. And I have just found that it's much easier to shave them. I mean, they never know they got a bad haircut from a veterinarian, so so I'm okay with it. In most cases, depending on your level of abilities, you may come out here and wipe this thing with alcohol and be good. She's gonna hold her elbow up like that right there. That's gonna allow me to access this a little bit better. And as bad as this sounds, if we had to, she can grab the base of the ear and put just a little bit of twitch on it. It will release some endorphins and he'll relax even more. We'll wait and see how it goes. And I'll go ahead and tell you, don't feel bad if you have to do more than one stick, because I do a lot of these and I still have to every now and then. All right, you ready? Hold off until your jugular groove pops up, and I mean, it looks like anybody should be able to hit that, but that's not always the case. Ready? Sticking. See how it bends and moves? Push the body this way. Just turn his head towards you. There you go. That's a good one. That's sticking out there. You want to be up higher, you can. And then we just let it run gravity. I stand here and stay here and hold off against this, and then she'll just kind of start relaxing a little bit more, let him feel like he's not being held. When you're holding these guys, less is more. So the less pressure you apply to them, the more likely you are to control them. Now, when they bolt, of course, you have to grab. But when you're trying to just stand here and do something like this, less is always more. So this, I'm talking about
If one's gone down.
oh yeah, it'll give them a lot of energy and it'll turn them around. But here's one thing that's extremely important. Everybody wants to mother their baby when it's born, okay? So if they see one that's not nursing, the first thing you do is everybody runs to the feed store and gets milk replacers, and they try to bottle feed the baby. First, bottle feeding them is a bad idea. But secondly, and more importantly, is you need to get your veterinarian involved prior to you trying to bottle feed. Because if you bottle feed one and then you administer plasma, you can cause an anaphylactic reaction and it die while you're standing here running plasma. So that is always, I've seen it happen in 3 foals. Thank God I wasn't the veterinarian on working on it, but I would just happen to be there and have seen it. So it does happen, and that's the biggest thing that owners want to do. And I mean, they want to help, but unfortunately it happens. And so if you can not do milk replacer, if you do milk replacer, you need to let your vet know when they arrive that, hey, this foal's been on milk replacer. Because you can pre-treat with dexamethasone and Benadryl to try to avoid it. One thing to note is if you're running this plasma and you feel like it's running really slow, I'm going to have you bring the bag down. Wait just a second. I'm going to have you bring the bag down. And I want you to watch right here on the camera. Put the camera. So bring the camera and watch right here. Bring the bag down below the, come on down, come on down, come on down. See, all right, go up. See the blood come back up. That's the way you can confirm that you're still where you need to be.
That IgG levels or any other antibody measures are lower in the animals?
No, not necessarily.
Is that why you treat?
So we treat out of, because how hard they are to survive, mainly from poor mothering, and just, I mean, they're just difficult animals. so we give this to try to help them. And since we've started giving this,
It's really made a huge difference.
I know of one we've lost, but I don't know that we've seen the loss like we had in the past. Now their IgG is going to run the same as what a foal would. Anything over 800 is passive transfer. I prefer them to be up, especially after running this, around 12 to 1800. And is she a maiden? Is this
No,
cattle?
she's had a
Okay. And so one thing that I do notice that in summer months, because of their gestation cycle, because most people pasture breed them, a lot of times we're foaling out during hotter times of the year. And this is something that it took me a few years to realize, that these things run a little bit higher normal body temperature than a regular foal. So I'm out here stressing over a 102.8 temperature like crazy. And when we run around and check the rest of them, they're all 102.8, so they do seem to run a little bit higher body temperature during the summer months. So just if you get in that situation and you get one up in the 102.8 and it is summertime, be mindful of it, but also know that I've routinely, not just on occasion, routinely seen higher body temperatures in these, and they tend to handle it just fine. We'll dip this one, we'll spray this one's navel here in a minute. And then I know he passed some meconium, but I'm gonna check him and make sure he's lost it all. So there's a good rule, it's called the 1-2-3 rule. You want the foal to be standing within an hour. You want them to be nursing within 2 hours, meconium passed, and the placenta passed within 3 hours. And so that's a very good rule to follow. We follow it religiously at the clinic. Foals are born. I don't try not to get involved until at that, once we start approaching those markers and we're not seeing what we're supposed to see, then we start getting involved. There is another method of doing this to where we give them 2/10 of torbagesic, butorphanol, which is a controlled drug, so it has to be, your veterinarian doing it. But they will not go to sleep like they're under anesthesia, but they will lay down and they will rest quietly for about 15-20 minutes, and they'll move a little bit, but not hardly at all. And so we do that on occasion, especially if I have a wild little foal, we'll do it. Generally on these guys, he's probably put up more of a issue than most of them.
Yeah.
If you see one starting to shake whenever you're doing this, that's not abnormal either. It just means that it's cooled off. You can take IV fluids that are body temperature, and by the time they run through the line and get to you, they're cooler than body temperature, so it will create some shaking effect from being cold. Pull that out. Just hold on to it just like so. Reach down and pull that up there. Just a second.
Sound good?
Sounds good. Just because Chris and Patrick's had this happen before, always taking my finger, run into their mouth, check their hard palate as far back as I can to make sure they don't have a cleft palate. We're good. Lubricant, KY jelly, anything like that. And so he still has some meconium Meconium is the round fecal balls that they have in them at birth. And he still has some. He's passing them, and they're all loose in there, and they're softer. So I'm gonna check and see if he just got most of them out. There's none over the pelvic brim now, so the only ones he's got is just right here. I'm gonna go ahead and help him out there just a second. We're done. Dilute Chlorhex or betadine is what you can use on their navel. Normally I'll take and have a shot glass is actually the best thing. Fill it up with it. I don't have one handy, so I'm gonna hold the side of it and I'm gonna spray this solution on there. Okay, I'm gonna let him go. So if you see a jack straining to defecate and then urine starts dripping from his belly like he's peeing too, it's probably coming from his umbilical stump. I'm gonna take